Good morning. My name is Saran Ephraim, and I am a member of the Georgia HPV Work Group, which is a subgroup of the Georgia Cancer Control Consortium. The HPV Work Group is comprised of members representing universities, medical health systems, including hospitals, community cancer coalitions, the American Cancer Society, the Georgia Department of Public Health, and pharmaceutical partners. Today's offering is the second in a three-part series titled HPV Vaccinations, Getting Back on Track. We will be discussing how to leverage data from GRITS and the value of reminder recall. I am the co-lead of the Health Systems and Social Engagement Subcommittee within the HPV Workgroup, and I have my co-lead Tanya Phillips with me today, and Janet Shin, a member, who will be helping facilitate today's session. We will go ahead and get started with a brief video. To obtain your CE credits for today's presentation, you must be in attendance for the full duration of today's activity. In addition, you must complete and submit your evaluation by November 4th, and you will receive the certificate of attendance by November 5th. And you should see the link to the survey in the chat box. You will also receive it via email after today's webinar, and you should have a link to it after the completion of the webinar today. Just a few housekeeping items. First, your phones and your videos will be disabled. So if you have a question or if you have anything that you need assistance with, please utilize the chat box. And as a friendly reminder, if you need to obtain CE credits, nursing credits for today's presentation, you must be in attendance for the full duration of the activity. So why reminder recall? Reminder recall is very important, and today's presentation is founded in part by the information found by the Community Preventative Services Task Force. The Community Preventative Services Task Force provides evidence-based findings and recommendations about community preventative services, programs, and other interventions aimed at improving population health. These findings are listed at the on the community guide. The Community Preventative Services Task Force is an independent, non-federal panel of public health and prevention experts whose members represent a broad range of research, practice, and policy expertise in community preventative services, public health, and health promotion and disease prevention. And based off of their findings, they found that reminder recall is an effective way of increasing immunizations in all types of population, and not just children's, but adults as well. We also wanted to share information from the HPV Roundtable resource. This document is titled Promising Practices for Adolescent Vaccinations During COVID-19, and it has a lot of resources about how to optimize patient data, how to conduct reminder recalls, how to educate your staff, and just improving your overall practice during the COVID-19 pandemic and when it comes to immunizations. The link will also be put inside of the chat for you. So it's important to optimize your patient data. Make sure you have a list of who is behind or overdue for their visits. And oftentimes your registry is your best friend to pull this information. And you can also use your electronic health records to run lists or alerts of patients who are due or overdue for their vaccines. Pulling your list of adolescents who have not been seen for a year is a good way to also clean up your information in GRITS or your IIS system to make sure that the list in your GRITS is aligned with your actual patient population. And this is also a great way to make sure you're getting all the patients up to date if they are behind. All right, so we'll go ahead and get our second poll of the day launched. So take a few minutes to complete this poll, or a few seconds, I should say. The question is, have you ever used GRITS to pull assessment data for your adolescent immunization coverages? The answer is yes or no. So I'm going to give you all a few more seconds to complete this poll. It looks like we have a little more folks saying no, and now we're at 50-50. I'm going to give you just a few more seconds to complete the poll. Okay, thank you so much for participating. So I'm going to go ahead and share the results. So it looks like we are about half and half, just a little more folks saying that they have not used GRITS to pull assessment data. So this is perfect. Thank you for coming and joining us on today's webinar.
Good morning. My name is Janet Shin. I am the Breast and Cervical Cancer Program Director at the Georgia Department of Public Health. It gives me great pleasure introducing my colleague, LaTanya Thomas-Smith. LaTanya Thomas-Smith is currently the Assessment and Field Services Manager with the Georgia Immunization Program. As Assessment Manager, Mrs. Thomas-Smith is responsible for managing the school and childcare annual certificate assessments, immunization quality improvement for providers, and 3231 provider certificate approvals. She further manages a staff of 13 immunization program regional consultants who are responsible for vaccines for children, quality assurance and improvement, and training statewide. LaTanya has over 25 years of public health experience in program development and implementation. She holds a Master of Business Administration in Healthcare Management and a Bachelor of Science in Community Health Education. Now I will turn it over to LaTanya.
Good morning, and thank you, Janet, for your introduction. As Janet said, my name is LaTanya Thomas-Smith, and today we will be discussing leveraging the IIS function to improve immunization practices. There we go. Okay. My objective today is to increase your knowledge of the IIS or GRITS and the role it plays in improving your immunization rates. I'd also like to inform you of the top 10 ways to improve adolescent coverage rates and to educate you on coverage reporting and the reminder recall process in GRITS. The Immunization Information System, otherwise known as IIS, which is the technical name for GRITS, Georgia Registry of Immunization Transactions. The IIS, or GRITS, is defined by the American Immunization Registry Association as a confidential, population-based, computerized database that records all immunization doses administered by participating providers to persons residing within a given geopolitical area. The benefits of the registry is that it connects people with information, promotes comprehensive immunization records, encourages accuracy in timing and dosage, increases visibility in areas of needs, and facilitates public health response in the event of an outbreak. The GRITS law, passed in 1996 and expanded by House Bill 1526, requires reporting by any persons who administers a vaccine or vaccines licensed for use by the United States Food and Drug Administration to any person. As a GRITS user, the provider accepts responsibility for the submission of immunization records according to the requirements of the registry legislation and may authorize additional members of the office staff to enter or review records. Access should not be provided to anyone outside of the organization to prevent any HIPAA violations. The Immunization Action Coalition, or an acronym that's used, IAC, recommends 10 top ways to improve adolescent rates. Those recommendations include immunizing every opportunity, using reminder and recall systems, implementing standing orders, taking part in an immunization registry, reviewing your patient's vaccination histories, following the U.S. recommended immunization schedule, scheduling vaccine-only visits, making vaccination education priority, making vaccination education a priority for parents as well as patients, establishing a rapport with your adolescent patients, and creating a culture that values well adolescent care. GRITS offers tools to assist with quality improvement in your practice. Coverage reports, which can be used in GRITS, are tools that compares the percentage of patients in your practice to the overall population. A reminder and recall report system is also available in GRITS. This process is to assist your practice with targeting the population due and overdue vaccinations. I will provide guidance on how to access and use both tools in GRITS. So let's talk about assessment reports for quality improvement. Assessment or coverage reports can serve as the foundation of childhood, adolescent, or adult immunization rate improvement activities. Some examples of how these reports can be used are to run a baseline report. You can run an assessment report to establish pre-intervention rates and identify the areas most in need of improvement. You can identify opportunities. You can implement or change clinic practices or begin outreach activities to address opportunities noted in your baseline reports. You can use the reports for evaluation. You can measure both the steps taken to improve clinic process and the improvement in immunization rates by monitoring activities, timelines, and by periodically rerunning assessments reports to decide to continue current activities or change course. Having solid improvement plans and activities in place can help healthcare providers demonstrate meaningful use of electronic health record immunization data and have better outcome data to report to public sources such as HSSE. Most of all, monitoring and acting to improve immunization rates help patients and the community from vaccine preventable diseases. The Georgia Registry of Transaction and Services, GRITS, has easy to use immunization assessment reports to help monitor immunization rates for vaccines recommended by ACIP. The assessment reports offer clinic-based immunization rates to assist in monitoring immunization coverage and quality improvement activities. The assessment reports can generate baseline rates, identify areas for improvement, provide data to assist with implementing practice change and/or outreach activities, provide access to regular follow-ups to evaluate whether practices change and or outreach is improving immunization rates. So GRITS produces three coverage reports. GRITS produces coverage reports for three populations. Those populations include childhood, adolescent, and adults. The reports provide condensed information into one summary report and or other support documents. Today, we will focus on adolescent reports. However, the process for requesting reports are the same for all populations. There are two types of coverage reports available in GRITS. There's a standard and custom reports. The standard report is based on the CDC coverage assessment guidance that assesses up-to-date vaccinations for the population 13 to 17 years of age. Up-to-date status is assessed at 13 years. The custom report allows the users to set the criteria for a specific age range or as of date. The adolescent series reviewed is 1 dose of Tdap, which is tetanus, diphtheria, and acellular pertussis, 1 dose of meningococcal, MCV4, and a booster dose of MCV4, 1 dose of HPV, and it assesses a complete dose, a complete series of HPV, which could be up to 2 doses or 3 doses. We are anticipating some updates to the reports. However, like most things in our lives, our priorities have been given to COVID activities. And so some of the updates that we did anticipate have been postponed for the moment. So what you're viewing on the screen currently is an example of the adolescent summary report that is produced in GRITS. The following report will be further explained in the following video on how to access reports in GRITS. But before I get started, I would like to explain a few things that I think I kind of didn't clearly explain during the video. And so one of the things that I just want to focus on just quickly, and it'll all kind of mesh together once you watch the video. At the end of the report, there is an area for missed opportunities. And in that area, if you can see the full presentation in the summary, this particular provider has 36% missed opportunity. So in this instance, the lower the number, the better. This number represents the percentage of patients that visited the practice in the last 12 months, but did not receive the recommended vaccines. And so that brings us to our first video on how to access and generate a report in GRITS. Let's get started. Welcome to the GRITS homepage. Today we will be discussing assessment reports, or typically called coverage reports. Coverage reports may be accessed in GRITS under the Assessment Reports tab. Coverage reports may be created through an export function using a standalone software called COCASA, or you may pull a report directly from I apologize. It seems we're having a little bit of technical difficulty with the sound. GRITS. Pulling a report directly from GRITS is the preferred method. We will only cover creating the report in GRITS for the purpose of this presentation. Let's get started. Assessment reports, again, may be accessed by clicking on the Assessment Reports tab shown to your left here. Once you click on the Assessment Reports, it will expand and you will see 4 different commands that you may use in regards to the assessment reports. You may request a CASA extract, which is an export function that I spoke of earlier, where you can pull data to import into the COCASA software. For today's purpose, we will not cover COCASA. However, if you want additional information in regards on how to use COCASA, I will give you information on how to contact us to receive those instructions. You may check the status of a request, create an assessment, and manage assessments. Checking the status of a request is simply going in and seeing whether or not the report is ready to be pulled. Creating an assessment is just that. You're creating your assessment and putting in the information you need to get the report that you need from the system. Managing assessment is actually being able to click on this area and go back and look at the reports that you've already created. So let's go ahead and create an assessment. When you click on create an assessment, this is the process you need to actually get the report that you're looking for. We have 3 different areas that you may access a report for: childhood, adolescent, and adult vaccinations. For the purpose of this discussion, let's look at the adolescent vaccinations. You have a standard report and a custom report that you can access. The standard report is a report that is built on the CDC requirements. So it's an assessment that looks at adolescents 13 to 17 years of age for the vaccines, 1 dose of Tdap, 1 dose of MCV and the booster dose, and then a complete series of HPV. This report is built for you, and you don't have to actually put in the criteria. If you choose to do a custom report, you would click on the custom population. It would take you to the screen, and then you would actually put in the criteria that you want to be able to pull the report. So for instance, the age range, you will put in the age range that you would want to assess. The standard is 13 to 17 years of age for the CDC. However, you can put in the ages that you want. For instance, if you'd like to put in 11 to 13 years, you could also put 11 to 13 years in. The as of date is actually what drives the group of patients that you're actually going to be looking at. So what this means, just looking at it now, and I'll go back in and put in 13 to 17 years of age here. So primarily what this as of date means, all patients in your practice would be reviewed as of today's date, which is the default. You may also change this date. We do recommend sometimes that you go in and you do the first of the month to get a complete series. However, using the default date of today's date is fine as well. And so what this means is that all children that are 13 to 17 years of age by 10/1/2020 would be pulled to do the report. And so that would be the birth date ranges of 10/21/2002 through 10/20/2007. The assessment date is the date that you're actually pulling the assessment, which is a default date of today's date as well. Once you've decided an assessment name, you would go in and type that assessment name here, And I do recommend that you put some identifying information in so that you can come back and know specifically what that assessment was. For instance, if you're looking or conducting an assessment for the month of October, you may want to put in adolescent October. But simply name your assessment, something that you can go back and identify that information later. Once you've been able to, and you've filled out all the categories there, you would click on Generate. Once you generate that report, it would take you to the assessment request screen. And on the assessment request screen, primarily you're in a holding pattern until your report is ready. You could click on, if you look here, you will see that the report, you'll see your assessment name is there and that it's been, the request has been started. If you click on refresh, you can actually see the status of that report. So at this point, 40% has been pulled. And so once your status is ready, you'll be able to actually go in and see your report. So just for a second, let me back up and show you what the standard report looks like. With the standard report, all of the criteria we filled in for the custom report is already there for you. Remember, the standard reports already have the age range and the criteria built in based on the CDC's criteria. So the adolescent report will look at 13 to 17 years of age. It will pull kids within that range. And then the birth date range is also standard. 10 based on today's date, 10/21/2002 through 10/20/2007. Again, you would name your assessment, and let me show you what happens when you don't name your assessment. So primarily what's going to happen is it's just going to put in an adolescent standard report, and then it will put in the name of your site. And again, your status will show here. Okay. We click fresh again. We're still here looking at 40% completed. Now remember, when you're waiting on this report, you go into a queue for the entire state for everyone that's pulled an actual report. And so the system has to work to pull these different reports. And so it may take time based on how large your assessment is to actually pull this report. Now, once the report is ready, and I'll go ahead for the sake of time and for the sake of this presentation, pull a report that was previously pulled. So once your report is ready and the status shows ready in your right-hand column here, you would go over and click on this little notepad emblem here under edit. And once you click on that, it will take you to the actual screen where you can generate your report. And so here under summary report PDF, you would click on generate output. Once you click on generate output, you will go down and actually see where your report appears here. Sometimes, according to how large the report is, your status could also be in a waiting pattern. And so you have to wait until this turns black and the status is 100%. So let's go ahead and open up the report. By clicking on the little page. Now for the adolescent report, you have a one-page summary. And the one-page summary, if you look at the very top, it will give you your demographic information as well as your criteria that your report was pulled based on. The birth date range, then the report run date, and the assessment date. At the top of all of our reports, we give a graph to actually show you where each antigen and where that antigen measures against the Georgia immunization average and the Healthy People 2020 goal. So if you look at this report, I'll just give an example. Tdap for this particular report was 77%, was just under the Healthy People goal of 80%, and the Georgia average that is the little black dot right here. So as you look down at the report, it will give you your specific coverage percentage. So for this particular provider, Tdap is at 77%. And then it'll give you the actual number here and how that number was actually assessed. Same for meningococcal. For first dose, you have 74%. So here you'll see that out of the total population of 29,252, 21,518 received at least one dose of MCV4, which gives you your 74%. The booster dose was 46%, which was only 6,155 of those that received that second booster dose, which was 13,518, which yielded your 46%. With HPV, and so with the HPV assessment here, we look at a complete dose. However, we do know that a complete dose can be 2 doses, but then there may be some in the sample that needed a third dose if they started on a 3-dose series to complete that dose. And so for those that received a first dose, we have 52%. And out of that 29,252, 15,234 received a first dose. The second dose, out of the 29,252, 11,412 received 39%. And then for those that were actually on a 3-dose series, which was around 17% that got an actual 3 doses. If you look further down, we do have notes, and we talk about HPV series completion rate. And so here, the HPV completion rate, which is for among the 14,736 clients who began the HPV series at least 6 months before the date of this report, 4,937 have received all 3 doses. Now, again, when this report was built, the report was built on a 3-dose series. We do anticipate updating this report, but of course, our efforts to updating the report has been postponed due to COVID activities. However, we do anticipate the report being updated as soon as possible. Missed opportunity rates for adolescent vaccines. For this particular provider is 80%. A missed opportunity is a visit in the last 12 months on which one or more vaccines have been given at this location, and more adolescent vaccines could have been given. Vaccines was indicated and no contraindication was noted in GRITS. The true rate of a missed opportunity is likely higher because GRITS has no record of visits that occurred without any vaccines being given. So right now, this is the only adolescent report that is available. I do know that many providers do like to be able to see a list of the patients that are not up to date. However, that functionality is not available in GRITS, and we are working to add that report. Again, we do anticipate as soon as we are done with COVID activities being able to update that report. And so primarily that is how you go in and actually pull a coverage or assessment report. And the functionality works the same for childhood as well as adult vaccinations. And I'll just click on it just to let you see. With the standard report for childhood, and we talked about this earlier in the presentation, we do have the CDC standard of 24 to 35 months. And that information would be completed just like with the adolescent report. And then you can also customize those reports as well. Same with the adult reports. A standard report is adults 18 years and older. And then you can also customize those reports as well. Now, the difference with the childhood report is that you can get more reports. With the standard childhood report, you are able to actually pull a report that will show a list of the children and their up-to-date status. And I did show you a copy of that previously in the presentation. So for now, that is everything on how to pull an actual assessment, or frequently called coverage report, in GRITS. The training guides are available, and they will be included, I guess, in the materials that you'll receive for this webinar. I do apologize. I was muted and had to find a mute button. So let's go ahead and start talking about reminder recall. Client reminder and recall interventions are used to remind members of target populations that vaccinations are due or late. Reminder and recalls differ in content and are delivered by various methods. It can be delivered by phone, letter, postcard, or text message. Most reminder and recall notices are tailored for individual clients, and many include educational messages about the importance of vaccination. There we go. In GRITS, you may generate reminder and recall notices, which include letters, cards, address labels, client listings, and downloadable text files. Reminder and recall notices are generated for every responsible person associated with the client, given that the following conditions are met. The client has to be active in your organization. The allow reminder and recall contact indicator on the client information tab has to be checked. The responsible person or persons notice indicator has to be checked. And the responsible person information has to be complete. The following video provides guidance on how to generate reminder and recall notices in GRITS. So the next video that we'll be sharing with you will not show you the actual notices that are produced, just to prevent any type of HIPAA default. So once you go in and actually start to work in GRITS and try to generate these reports for yourself, I do recommend that you review and assess the reports that are generated, just to see what will work best for your particular practice. So we'll move on to the next slide, which is a video on how to generate reminder and recall notices in GRITS. From the reports menu option, you may generate reminder and recall notices, which includes letters, cards, address labels, client listings, and downloadable text files. By clicking on reports and then request reminder, you will be brought to the page where you can start filling out your criteria for your reminder recall. First, you must indicate whether you wish to use the tracking schedule associated with each client or a uniform tracking schedule for clients by clicking the appropriate radio button. If you choose to use one tracking schedule for all clients, choose the appropriate schedule from the pick list provided. Then we must select the vaccine group. Indicate whether you wish to include the vaccine groups in the search criteria, or if you wish to include only selected groups by clicking the appropriate radio button. For the purpose of this training, we're going to select HPV. And you can do that by double clicking or clicking on add. Be sure that you see what you've selected is in this window. If it's not in this window, then it has not been selected. Then you must select a primary care provider. If you are logged in under your site, your primary care provider screen will reflect the name of your clinic as well as the physicians associated with that site. And I am going to use Creekside Pediatrics as my example here. You may also enter additional demographic criteria just to kind of streamline or narrow your search, because we are using a standalone practice that serves a specific area, we won't be using this criteria for this training. However, if you would like to focus on, say, for instance, a county where you know you have, say, an outbreak, or you want to focus on a specific city, you can put in that city. You can narrow it by zip code and also county. So then you must enter your target range. You can either enter your target range or you enter your data range, your date range, by looking at your target date. If there's a specific date you want to look at, the report will include clients that are due or overdue for immunizations within that date range. If you want to look at the birth date range, the report will return those clients who have a birth date range that falls within a specific birth date range. For this training, I've gone in and actually selected just to look at a few months. So we went in and we looked at August as our begin date, August 20th through or to October 20th. And again, if you have a specific birth date range that you want to look at, you can also include a birth date range. With the birth date range, typically, if you are looking and conducting a coverage assessment, you may be able to just go ahead and use the birth date ranges that you pull from those coverage reports here as well. Now, the weeks since last notice, when a number is entered into this field, the report will include only those clients who have not received a reminder recall notice within the date or the number of weeks that you specified here. And for the purpose of this training, we won't be using that. You can also exclude the number of months. The system will exclude the clients overdue by more than the number of months you have selected. So it will exclude clients based on those that are overdue. For instance, because I feel like I'm kind of babbling here, you may want to exclude those that are over 12 months. Typically, clients that have not been back in your practice for more than 12 months, by definition, may be inactive in your site and have moved and gone elsewhere. So you may want to exclude any kids that haven't been in your practice for more than 12 months. For the purpose of this training, I'm going to go ahead and take that out. You can narrow your criteria also by selecting if you want to look at just females or males only. You can do that. And for the purpose of the training, we're going to look at all. You can further narrow your criteria, or at least organize your data by sorting the information based on last name, first name, and ascending and descending order. So we're going to sort our request by first name and by last name, and then first name in ascending order. So once you've completed all of your criteria, go ahead and click on Generate. And again, like all reports or most reports in GRITS, you will be redirected to a page where you will sit and kind of just wait for that report to actually pull. I went ahead and pulled a reminder recall prior to me recording this training, and it's already completed, so we won't have to wait. Now, just like the coverage reports, how quickly this report pulls or comes up is going to be based on how large the file is or how many clients are in the sample that you've actually pulled. For instance, with this one, we had 758 And it took around 5 or 6 minutes for me to be able to pull this request. So once the request is complete and the status is 100%, you can click on the hyperlink. It should turn blue. And once you click on it, it will take you to the process summary page. In the process summary page, and I won't read through every aspect of this, however, it will list how many clients are associated with the practice, and then it'll tell you exactly how many of those clients actually met the criteria that you put in. If you scroll down to the bottom, the reminder request options are there. And again, like we said in the beginning, you can pull a reminder letter, reminder card, mailing list, and a client query listing. Just to prevent us exposing or sharing any clients associated with the provider we're using that as an example, I won't pull this up exactly. However, if you click on the reminder letter, it will actually, this is what you'll see. It will have an output status, and in that output status, it shows you, just like any other reports, the status, and when it's ready, you can click on the hyperlink and it will actually pull up the letter, the card, the address labels, or the listing that you've requested. And again, I won't pull those up just so I won't expose any of the names of any of the patients associated with this practice. Now, one thing to remember about from the reports menu option, you may generate reminder and recall notices, which includes letters, cards, using a lot of kids are sending reminder letters or recall in your system is cleaned as much as possible. We do see larger, it will actually labels or the listing that you've requested. And again, I won't pull those up just so I won't expose any of the names of any of the patients associated with this practice. Now, one thing to remember about reminder recall is to make sure that your data is actually in your system is cleaned as much as possible. We do see larger samples with the adolescent population. However, it would be good to go through and inactivate as many clients as you know that are not in your practice any longer, so that when you pull these reports, you're not looking at a lot of kids or sending reminder letters or recall letters or cards, out to addresses or to patients that are no longer associated with your practice. The process is fairly simple, and you can pull this as often as needed within the criteria that you need it. So I guess that's it for the reminder recall process. Again, instructions for this process or being able to pull your reminder recall notices will be available along with the other materials for this webinar. Thank you, everyone. I realized we had a small delay, and so I tried to back the video up so that you could hear the full presentation. Of course, with glitches go along with these virtual presentations that we do all the time. So I do appreciate your patience and understanding with our small delays there. So that's it for the videos that we have, and that's the actual training or how it looks in GRITS. And the reports and pulling the reports, it's very user-friendly and easy to actually pull or to access these reports. And so even though we're given a presentation and you can also get the instructions, one of the key things when it comes to GRITS and figuring out what works best for you and what's simple, the process is simple. It just takes some time and just playing with it so that you can figure out what part of the reminder recall is actually works best for you. And so it does take just a little practice there to get exactly what you need. However, these tools are there and support is there whenever you need it from the program. So let me move on to the next slide. And I apologize again, I'm experiencing a little delay with the next slide. So before I leave my presentation, I just want to do a little shameless blurb about some of the programs that we also offer through the Georgia Immunizations Program. If you currently are a part of the Vaccines for Children's program, we do have a quality improvement program available called IQIP, and IQIP is Immunization Quality Improvement for Providers. And so IQIP, the purpose of IQIP is to promote and support implementation of provider level immunization quality improvement strategies designed to increase vaccine uptake among children and adolescents to adhere to the routine schedule recommended by ACIP. And so primarily the assigned, your assigned representative from the program will work with you to provide technical assistance in 3 core QI or quality improvement strategies. And those strategies include scheduling the next visit before the patient leaves, leveraging the IIS function to improve immunization practices, that's what we talked about today, and then to provide recommendations specifically with improving your HPV rates. And so your immunization regional consultant would actually work with you over a 12-month period to look at the different quality improvement strategies, and they would work by meeting with you periodically to discuss your start and then a progression, and then we'll look at within 12 months an improvement there. So we do have this program available to our VFC providers. Okay, and I'm going to turn it back over to Saran really quickly, and then we'll have one final.
Thank you, Latanya. We appreciate you for sharing that. We can advance to the next slide, please. And while we do that, there were a few questions that came up, Latanya, for you. The first one was, can you still have the reports running in the background if you get timed out? Will they still continue to run?
So the answer to that is yes. You can continue to work when you go in and actually request a report. You can leave that area, go back and do other things within GRITS while that report is running. There is a place for both reports, for reminder recall and for coverage reports, where you can go back and access that report by clicking on managing your request. And once you click on that, you can go back and actually look at the status. So moving around in GRITS does not affect your report being.
Okay.
Okay.
Thank you, Latanya. And there's another question that asked, does the report, does it still pull a letter for everyone that is listed in GRITS as a contact? And is there a way to print a list of all patients listed under your providers?
So it's based on the criteria that you put in. And so you would have to know, I guess, put in a broad range to be able to include everyone in your practice, but you have to specify a range. And I'm not sure that you would want to pull a list of everyone that's in the practice. That's a huge file. And when you pull those larger files, it may take, literally, we do have some instances where it may take a whole day to pull a file. So that's why the criteria is there to actually, why it's there built in, so you can break those up by age groups. And I would recommend that you break it up by age groups and not try to do a larger sample, because it will slow down the process. And so, Ron, what was the second part of that question? I think
It asked, does it still pull a letter for everyone that is listed in GRITS as a contact for that patient when you do the reminder letters?
yes, it will still pull that
Okay,
information.
thank you. All right. And then we just wanted to reiterate that there's access to GRITS is limited to those providers who are actually in GRITS as immunizing providers. And like Latanya mentioned, that no one outside of that practice should be receiving access to GRITS. We want to thank you all so much for being with us today, for participating. If you have additional questions, feel free to send us an email or shoot it in the text box, and we'll be able to follow up. And we just want to make sure that you're aware that we have another webinar coming up titled We Have the Data, Now What? And please be sure to register for that. You can find that link here, and it will also be posted inside of the chat box for you. We want to thank you so much for your attendance on today's webinar. And you will receive access to the recording once the webinar has been completed. Give us about a week or two, and we'll make sure we make the recording of today's presentation available to you all. We will also be able to share the resources that Latanya mentioned about accessing the reports that she taught you all how to do today, as well in that email once we send it out. Thank you all again. We look forward to seeing you on our November 19th webinar. Have a wonderful afternoon.